Hello, and welcome to the Regional Municipality of Wood Buffalo Virtual Community Town Hall. Thank you for taking the time to learn more about our region's response to COVID-19. I'm Jillian McDonald, and I will be your moderator for today. We have a panel of people who will be joining us to take questions today. In the room, we have Mayor Don Scott, Scott Davis, the RMWB's Director of Emergency Management, Jamie Doyle, the municipality's Interim Chief Administrative Officer, and Kevin Weidlich, the President and CEO of Wood Buffalo Economic Development Corporation. As well, we also have joining us on the phone, Kareem Zarifa, the Executive Director of the Oil Sands Community Alliance, Ian Fox, a Northeast Alberta Field Officer with the Alberta Emergency Management Agency, Chad Santo, a First Nation Field Officer with the Alberta Emergency Management Agency, Murray Crawford, Senior Operating Officer with the Alberta Health Services, and who is, of course, here at our Northern Lights Regional Health Centre. Also with AHS, we have North Zone Medical Officer of Health, Dr. Kristen Klein. Today we will be talking about our organization's response to COVID-19 and taking questions related to that. Mayor Don Scott is going to give some opening remarks, followed by our Director of Emergency Management, and then the Medical Officer of Health. But first, I want to let everyone know that if you wish to ask a question, please hit *3 on your phone and we will get you into the queue. Now I would like to turn the floor over to Mayor Scott.
Thank you very much, Jillian, and good evening, everyone. I'd like to begin by acknowledging that we are conducting this call on Treaty 8 and unceded Métis territory. I want to thank you all for taking the time for joining us on this community town hall. And I want to thank all our experts and panelists for being here this evening. I know this is a stressful time for many of you, and there are a lot of unknowns. I want to reiterate that it is important that everyone remain calm and continue to take the necessary preventative measures. Where you see that you should be doing something related to COVID-19, read that as you must do that related to COVID-19, such as washing your hands and social distancing. They are absolutely mandatory in my view. We must stop the spread of this virus. We are all going through this together, and we will get through this as a community. I encourage everyone to reach out and offer support to neighbors, friends, and family members, especially older adults in our community. There is no reason why anyone should be experiencing this alone. I'd like to remind everyone that there are mental health resources available for anyone who may need support during this time. Public health and safety is and always will be our priority. I want to assure everyone that the municipality is taking this situation very seriously and is well positioned to address this pandemic. Our region has faced challenges and uncertainty before, and we have been aggressive in our response, and we will be again. This challenge will have a profound impact on economic security and business health. We need to position ourselves to bounce back. I'd like to thank municipal staff who continue to take an aggressive approach toward this pandemic, and all those who continue to come to work to provide the essential services that keep our region moving. I'd also like to thank all of the frontline healthcare workers and public health officials and authorities. We, as a municipality, support you. I'd also like to thank all levels of government. I've had conversations with the Premier's office. I've had conversations with the Minister of Health's office, and all levels of government that I have spoken with are taking this extremely seriously. I'd also like to thank everyone who is following the public health recommendations and doing their part to keep our community safe. I believe that we must respond to this challenge aggressively and decisively. Let's look out for each other and get through this together, and I look forward to taking your questions.
Thank you, Mayor Scott. I want to remind you again, if you wish to have your question put into the queue, please hit *3 on your phone. Next, we will hear from Scott Davis, our Emergency Manager of Director of Emergency Management.
Thank you, Mayor Scott. Good evening, everyone. And thank you for joining us to stay informed on the municipal response to COVID-19. My name is Scott Davis, and I am the Director of Emergency Management at the RMWB. As Mayor Scott mentioned, we're joined tonight by RMWB CAO Jamie Doyle, Dr. Kristen Klein, and Dr. Murray Crawford from AHS, officials from Alberta Emergency Management Agency and industry, and Wood Buffalo Economic Development President, CEO Kevin Weidlich. I'd like to remind everyone that AHS is the leading authority on our response to COVID-19, and we'll be providing an update right after I'm done. And after all, be available to answer your questions. As you know, this is a dynamic situation that continues to evolve. Earlier this afternoon, Alberta's Chief Medical Officer announced that there are now 419 confirmed COVID-19 cases in Alberta, including 23 in the North Zone. I know it can be stressful as the number of confirmed cases increases, but with the nature of this virus, this was expected and planned for. Our response to COVID-19 has been steady and consistent. We are beginning preparing for this possibility in January. As a community, we've been taking aggressive measures to prevent the spread, flatten the curve, and protect the region. Prevention begins with people taking care of themselves. You should be following all public health recommendations, staying home if you can, keeping 2 meters away from others, washing your hands and covering your cough, and self-isolating and calling 811 if you have symptoms. Everyone has a role to play, and I would like to thank all community members who continue to follow these public health recommendations, respect the closures in the region, and adjust their everyday lives to protect themselves, their family, their neighbors, and our community. As a municipality, we have closed all facilities, parks, and outdoor amenities. Emergency social services are keeping in contact with our social service partners. Staff are contacting and providing support to all residents registered in the Vulnerable Persons Registry. At last night's council meeting, it was determined that residents have the opportunity to defer utility payments until July. Enforcement of the single-use shopping bag will be temporarily suspended, and Wood Buffalo Economic Development is establishing a task force to support local businesses and help them recover from the impacts of COVID-19. Continue to work extremely closely with Alberta Health Services, our Alberta Emergency Management Agency contacts, and are in regular conversations with health officials and different levels of government. There's also a team working out of the Regional Emergency Coordination Center that it is dedicated to sharing regular information with our Indigenous partners, Métis groups, industry stakeholders, and other community groups. This is very important dialogue, and we continue to check in with these groups regularly, along with the other preventive measures that community organizations, First Nations, and rural leadership and the provincial and federal government have taken. Our region is well positioned to deal with the impacts of this virus. We have been expecting the presence of COVID-19 in the region, and we are well prepared. As this situation continues to evolve, please know that the municipality is here for you and will continue sharing information about the regional response as it becomes available. All updates and service changes will continue to be available on the municipal website, rmwb.ca/COVID-19. Alberta Health Services remains the trusted authority and primary information source on public health recommendations in our region. Factual, up-to-date information will continue to be available on the AHS website. As mentioned earlier, we must remain calm, follow all public health recommendations, and stay the steady course. We are a resilient community that has been faced with challenges before. Let's look out for each other and continue to work together. Stay informed, stay safe, stay strong. I'd now like to turn it over to Dr. Kristen Klein from AHS.
Hi, good evening. Oh, thank you. Good evening, everyone, and thank you for including Alberta Health Services in your meeting tonight. I think a lot of the key messages that I would have liked to articulate have already been mentioned including the general preventive measures that people can take to protect themselves and their families, like washing their hands, maintaining social distancing, and following the recommendations from public health. And I just want to emphasize how important it is that people with symptoms, regardless of how minor they are, so even a cough or sore throat, to stay home and self-isolate for 10 days from the onset of symptoms until symptoms have resolved, whichever is longer. And that's really a proactive measure that you can take to protect your families, your loved ones, and your community. And Alberta Health Services is going to continue to work to make sure that we are taking the measures we need to take to ensure that Albertans are safe and healthy. And I want to thank you for doing your part in doing that as well.
Thank you so much, Dr. Klein. Okay, so now we are going to turn to questions that are in our queue. I want to remind you that if you wish to ask a question, please hit *3 on your phone. Our first question will be coming live on the line from Joe. Joe, your line is live. Please go ahead.
I'm just I work out at Albion Sands. I've been out there for about 2 years. They have their own private airport where they're still flying people in and out, and in my opinion, it's probably one of the worst problems for our community. I mean, we didn't have, other than the obvious new case that from the dental place, we didn't really have any cases prior to the guy from camp. I mean, it ended up being negative, but I mean, we're still flying in from hotspots, Alberta, or in Calgary and Edmonton. So I just want to know what we're doing about fly in, fly out.
Thank you for that question, Joe. We're going to ask Scott Davis to take that one on. Scott, go ahead.
Thank you for the question, Joe. I understand your concern. We continue to engage with our regional industries, including Albion Sands. We also engage with their emergency management and emergency services group, as well as leadership. I can't answer as to what their direction will be. However, I would suggest that ensuring that your supervisor is apprised, and if those discussions aren't positive, then I would suggest contacting Alberta Health Services through the alberta.ca COVID-19, and perhaps they can help you.
Thank you, Scott, and I believe Mayor Scott would like to weigh in as well.
Yeah, I just want to, and thank you for the question, and I'm deeply grateful to all those that are participating in this. I think anybody who has been following the history of this issue in this region knows my feeling about fly in and fly out. And this is just one more reason I don't think it's something that should be a long-term plan of any industry in this region. I've raised it with our industry partners. It's something I'm obviously concerned about. Part of the motion that I brought last night was to address the camps and make sure that only essential employees are residing in camps and that all camps are strictly adhering to AHS guidelines. Kareem Zarifa with OSCA, that's the Oil Sands Community Alliance, assured me that they were taking exceptional measures in camps to make sure that people are kept safe. And I believe with the industry discussions I've had that they are taking exceptional measures right now. And I believe our partners are going to do their best during this time to keep us safe.
Thank you so much, Mayor Scott. Again, if you would like to ask questions of our panel, please hit *3 on your phone. We are going again live on the line with Joseph. Joseph, your line is live. Please ask your question.
Yeah, my question would be to Alberta Health. Last week, I went out to Edmonton. On my way down there, I had to stop at this with the Hodorite. So these guys, as much as I know, they don't have access to TV, internet, or radio. So up there is still business as usual. So they still want to do business the old way, shake your hand, sit down, take coffee. And their population there is about 70. So when I was talking with the head of the guy over there, I told him what is happening. He was sounding surprised. I said, man, this is how things will be working around. I mean, this is how we do things now. This is how we shake, how we greet. So my question is, is Alberta Health doing anything to send people to this kind of group, like these farmers or like these Hudderay colonies, to help them out with information because they don't have any? And number two question is, in the place of worship, how many people are allowed to worship at the moment? Is it 5, 10? What's the number right now? Thank you.
Thank you for that question, Joseph. Dr. Klein, would you be able to address that for us, please?
I can say that Alberta Health Services works within our zone structures to respond to the needs of individual communities. So within the North Zone, we don't have any particular activities with Hudderay communities, but I know that is an issue across the province, and our colleagues in those areas are working collaboratively with their partners to make sure that people are aware of what they need to do and the measures that people should be taking to protect themselves. I think the second piece was about how big of groups people should be in. I think the general recommendations are to minimize contact with people outside of your immediate family whenever possible. And so we know that from the Alberta government, there have been restrictions on the number of people that can gather. So they're not recommending gatherings of more than 50 people, with those numbers likely to decrease as we're seeing more and more cases in the community. So I think my general advice would be to maintain social distancing whenever possible, so that 2-meter space between you and other people, and maintain good respiratory hygiene and wash your hands often and well, and those are the best things that you can do to protect yourself.
Thank you for that, Dr. Klein. While we have everyone on the line, we'd actually like you to participate in a poll this evening. In the event that we have another community town hall, we would like to know what would be your preferred time of day. Please, on your phone, press 1 for weekday morning, press 2 for weekday afternoon, press 3 for weekday evening, press 4 for weekend, and press 5 if it doesn't matter what time we host one. Again, I'll read through those options. If you would like us to host during a weekday morning, please press 1. Press 2 for weekday afternoon, press 3 for weekday evening, press 4 for weekend, and press 5 if the time does not matter. We are going back to our questions now, and live on the line we have Francine. Francine, your line is open. You may begin.
Thank you. One of my questions is, how many confirmed cases are there in Fort McMurray? Another question is, are we going to be doing what a lot of other cities are doing, and are you going to be putting us on lockdown? And my third question is, what is being done to help our homeless and people who are on assistance?
Thank you for that question, Francine. We will have Scott Davis address that.
Thank you for your question, Francine. To address the answer, I would have to ask Dr. Klein to confirm that. As yet, I have not officially received confirmation of a number. I understand, though, through social media there's 2. However, I would defer to Dr. Klein for that. When you speak of lockdown, there's a number of different mechanisms that are available under a state of emergency by the province, state of local emergency by the regional municipality. Mayor Don Scott brought forward a number of different questions to us yesterday. We continue to evaluate those, and what I consider to be a ripple effect, we're always cognizant of one action and what's the reaction and whether that's sustainable. So we work with our partners in Alberta Health Services as well as Alberta Emergency Management Agency. So short story is we're reevaluating all of that. When it comes to the homeless, I'm very proud of the excellent work that our Emergency Social Services Group as well as other RMWB departments are working for our homeless and our vulnerable populations. They're engaged at the provincial level as well as with Alberta Health Services how to address these populations. If you go to rmwb.ca, catch up to our latest communications broadcast. There is material on there about what we're currently doing for these populations.
Thank you for that, Scott. And a reminder, if you would wish to ask a question of anyone on our panel, please hit *3 to ask a question. Moving on, we have Vicky live on the line. Vicky, your line is open. Please ask your question.
Hi, my question is for AHS or Dr. Klein. So I'm just wondering, what is AHS doing to expand and make mental health services readily available in the region, given the circumstances? And if there are currently measures in place, what are they, and where can people access that information?
Thank you for that question, Vicky. Dr. Klein, go ahead.
I think that likely that one is better addressed by Murray, although I would like to go back to the previous question, which was a question about how many cases there are in Fort McMurray. And I can confirm that there are 2 cases, and the numbers are updated on a daily basis on the alberta.ca/COVID website. If you actually click on the Get More Data link, it will show you a map of where there are confirmed cases in the province, which is, again, updated daily. And so maybe I'll defer the rest to Murray.
Go ahead, Murray.
Yeah, hi there. Thanks for the question. What is AHS doing to expand mental health addictions and mental health programs? We're just revising. In fact, I just approved the plan for the North Zone to modify our mental health and addictions programs. Obviously, it's a little more difficult when you're in a state of self-isolation and social distancing. And so most of our amendments to the way we're going to conduct business are really more about changing the modality of the way services are offered. So instead of one-on-one, face-to-face, we're going to be using telehealth. Probably Zoom will be the platform it's going to be on, using virtual and remote. And really, that's the sort of, there is absolutely no plan to cancel any services at this time in the way of addictions and mental health. There will be modifications to them during this period where we, are going to restrict visitor visits on inpatient, modifying day passes, and really shifting services to minimize human contact.
Thank you, Murray. Again, if you would like to ask a question, please hit *3 on your phone. Our next question comes from Laura, and Laura asks, does Northern Lights Hospital have non-invasive ventilation equipment? Perhaps we could have Murray answer that.
I'm not the person to ask for that. That's a physician question, and I'm not a clinician by background. We certainly have ventilators in the building, and we have a 7-bed ICU with a large emergency department, and are capable of taking care of people with respiratory issues. So, Dr. Klein, do you want to comment on that?
I cannot comment specifically on what is in the hospital, but there is other ways of delivering air to people that need it, of which they would have that available in the hospital. One example is the CPAP, which gives positive pressure air to somebody without having to be intubated. So that is an example that would be available at that hospital.
Thank you, Murray, and thank you, Dr. Klein. Again, if you would like to ask a question, please hit *3 on your phone. Our next question comes from Sachin. Sachin wants to know, will there be a check stop going in and out of town if the new provisions are passed? And Mayor Scott, I will ask you to address that.
Thanks very much for that. We were in discussions with the Minister of Transportation and his staff, and they've indicated very forcefully that they do not believe that we have the jurisdiction to have either a check stop or to block traffic in any way that's coming into this community. So it's something that there's going to be ongoing discussions about, but at this point there are no plans for a check stop or to stop any traffic. I think it's important that we keep getting the key routes and the key deliveries that are coming into this region. So obviously we want to make sure that happens, and I don't want to expose people at check stops to the potential for being exposed to this virus. So there are no plans at this time, and that would be a decision that would have to be made by the Minister of Transportation, and that's a provincial decision.
Thank you, Mayor Scott. Next, we have a question coming in from Tom. Tom, your line is open. Please go ahead. Okay, we seem to have lost Tom, so I'll just read out his question. Tom would like to know, what assurances do we have that local businesses will have support? Kevin, maybe we'll have you address this, please.
Yes, thank you for that question. So as far as assurances go for providing support, we are introducing a task force that will define exactly what that support will be. So I'm confident that there will be support in place. Exactly what that looks like will be developed over the coming days and weeks, with a view to having it implemented post the immediate response period of this public health emergency.
Thank you for that, Kevin. Again, *3 on your phone will allow you to get your questions into the queue. Our next question comes from Dolores. Dolores says, as an Indigenous person who is displaced at the moment, who can I contact? Scott, would you be able to address that?
Yes, sir. Thank you for the question, Dolores. I continue to engage with our Indigenous partners. I would suggest that reach out to your local leadership. My understanding, and it's been confirmed, that they are actively engaged with First Nations and Inuit Health Branch, as well as Indigenous Services Canada. Thank you.
Thank you for that, Scott. Our next caller is Aaron, live on the line. Aaron, your line is open. Please go ahead.
Hey, thank you for taking my question. Just want to state that the motion put forward by Mayor Scott, I support that fully. And, on to my question here. What are we doing to ensure that Northern Lights Regional Hospital has the staff and medical supplies to deal with an influx of COVID-19 patients if that does occur? And have we looked at possibly maybe having a second site set up somewhere other than Northern Lights Regional Hospital?
Thank you for that question, Aaron. Could we have Murray address that, please?
Yeah, sure. Good evening. Yes, absolutely. We've been preparing for COVID, as was mentioned in all the introductory remarks. We've been preparing for this when it was still known as coronavirus. And so we've been at this since January. We've certainly been, we have the one advantage of having a provincial health system is that we have a central procurement department, and they purchase our supplies. So we're very well supplied for medical supplies and personal protective equipment to protect our staff and patients, as well as staffing is always a concern in a pandemic, obviously. I mean, if people get sick, what do you do? And so we've got some contingency plans for that, and right now we think we're okay. First priority is obviously protect the staff and ensure they're doing all their proper donning and doffing of protective equipment. And we have plans in place for staffing, even if at a reduced level. So yes, we're confident that we can provide the care that is going to be required for the duration of the pandemic in Fort McMurray here at Northern Lights.
Thank you for that, Murray. We'd also like to remind everyone that the Government of Alberta's webpage, alberta.ca/COVID-19, is an excellent source for preparedness and prevention information. So again, that website is alberta.ca/COVID-19. Our next question comes from Haley. Haley asks, how are you enforcing park closures? Perhaps we could have Jamie address this, please.
Thanks, Haley. It's a great question. Currently, we have our bylaw officers as well as peace officers patrolling throughout the community, helping to educate those residents who are still using or utilizing those playgrounds as well as parks. Additionally, the dog parks and specifically we have locked.
Thank you for that, Jamie. Again, if you wish to ask a question, please hit *3 on your phone. Our next question comes from Matthew. Matthew asks, are health clinics still open, and what are the future plans for the clinics? Dr. Klein, could you take this one?
I don't think that maybe I'm the best person to answer that specific question. Murray, do you think you could answer that one?
Yeah, for sure. So which clinics are you talking about? I guess just some clarity on, are you talking about clinics that are inside Northern Lights, or are you talking about primary care clinics that are outside of the facility?
I would infer from reading this that that's outside of the facility.
Right. So clinics outside of the hospital are run by the Wood Buffalo Primary Care Clinic, Primary Care Network, and they will remain open. And we dialogue with them on a daily basis in our normal operations meetings. And right now, they're confident they'll stay open for the duration and continue to provide care.
Thank you for that response, Murray. I appreciate it. Our next question comes from Colton. Colton asks, will grocery stores and restaurants, takeout and delivery, continue to operate as they are now? Scott, could you address this?
Thank you, Colton, for your question. We continue to take a lead from Alberta Health Services and the direction from the Chief Medical Officer of Health. My understanding is we're continuing with the path that we're following. Part of this is we're cognizant that negatively impacting the economy is one of the things that I know the Premier is very concerned about, as well as all of us in emergency management, and I would suggest very forefront of Mayor and Council. So until there's a change in direction from the province, I would suggest not.
Thank you for that, Scott. Again, if you would like to ask a question of our panel, please hit *3 on your phone. Our next question comes from Roger. Roger asks, what actions will the RMWB be taking if people are not abiding by the social distancing rules? Can bylaw enforce it? Jamie, I'll have you address this, please.
Thank you for that question. Some of the actions the RMWB has taken as proactively with posters as well as educational awareness on buses specifically, exercising social distancing, as well as encouraging those riders to certainly do that, as well as playing audio message on buses to ensure people are constantly thinking of it. As for social distancing out in the general public, it's not something we're patrolling and stopping people for, but what we are hopeful is that the public understands the responsibility to practice social distancing to help stop the spread of this virus.
Thank you for that, Jamie. Our next question comes from Alan. Alan asks, if you have not already planned this, could you kindly speak to the possibility of taking walks, obviously respecting social distancing? Perhaps Mayor Scott, could you take that one?
Yeah, there's no restrictions on taking walks in the community. Some places are closed, obviously, and some parks. We've closed parks, we've closed the dog parks, but people are permitted to walk. But it's not something I'm asking. It's something that I am. It's more than an ask. We really need to be careful about social distancing. Keep your distance from groups of people. Do not go as a group anywhere. It is absolutely imperative that we make sure that this virus is shut down and we meet it head on. So if you go for a walk, just please keep your distance from anybody else who might be out walking. What I've heard is happening in other communities, in other regions, is if you see somebody coming towards you, people step aside and they give the appropriate distance while the other person walks by. You know, it's something. What I recommend is that if you're going to go outside, it's okay to go for a walk, but I prefer that people only go out for essential activities and, you know, get your exercise, then go back in and be safe.
Thank you for that, Mayor Scott. Our next question comes from Jason. Jason is live on the line. Your line is open. Please ask your question.
Hi there. Good evening. How come the amount of days required for self-isolation has changed from 14 to 10 in the region when the rest of the country remains at 14?
Thank you for your question, Jason. Dr. Klein, would you be able to address this?
Sure, I can. I think that a piece to consider here is that there's actually two different types. Sorry, I am with screaming children. There are two different types of days to be considered. So one is the days since you've had an exposure risk. So that's when we're talking about return from somewhere outside of Alberta. If you've had a close contact with someone that's known to be a case, that recommendation is 14 days. And the reason for that is the incubation period for the COVID-19 virus. So that's the length of time it would take to potentially develop symptoms consistent with the virus that you could then know you had it. Because what we don't want to happen is to have somebody out in the community and get symptoms and put other people at risk. The 10-day period is for when your symptoms have started. So anybody who's experiencing symptoms is also asked to self-isolate for 10 days. And that is because that's the period that we know that the virus can transmit from person to person. So if you are infected, if you stay home for those 10 days and don't expose anybody else, then you, as long as you don't have symptoms anymore, you don't pose a risk to other people. So that's the difference between the different days, and I know it can be quite confusing for people.
Thank you for that, Dr. Klein. Again, if you would like to ask a question of the panel, please hit *3 on your phone. Again, that's *3 on your phone. Our next question comes live on the line from Douglas. Douglas, your line is open. Please go ahead.
My question, I would like to ask, what non-essential services are supposed to be closing down to reduce risks? For example, cannabis stores and liquor stores are still open, and should they close down?
Thank you for that question, Douglas. Scott will take that one.
Thank you, Douglas. A very important question in our community. And while I would defer to the healthcare individuals for a definitive answer, I would suggest we have to be cognizant of the populations that have addictions and dependencies on alcohol and other materials. So I would suggest that to close those may have a bigger impact on the community. Again, though, I would have to take the guidance from Alberta Health Services. Sorry.
Thank you so much, Scott. Our next question comes from Jason. Jason asks, are people allowed to travel to and from other cities? We'll have Scott Davis address that.
Thank you for your question. As it stands now, Albertans are free to move around, and until we see a change from either the Premier's office or Alberta Health Services, I would expect that would continue.
Thank you, Scott. Again, *3 on your phone will get your question put into the queue. Our next question comes live on the line from Francois. Francois, your line is open. Please ask your question.
What is your current policy on the use of the Birchwood trails? I understand this has been addressed to an extent previously, but still uncertain.
Thank you for that, Francois. Jamie, could you answer that?
Thank you for the question, Francois. Birchwood trails are still open for use. However, as I mentioned earlier, I please implore you to practice social distancing. It can't be more important.
Thank you, Jamie. Our next question comes from Becca. Becca asks, are you accepting donations for people in need or for nurses? Scott, could you address this, please?
Yes, thank you for that. My understanding is that Alberta Emergency Management Agency is currently looking after that. If you go to alberta.ca/COVID, there is direction on how to access that link or website that'll clarify that for you.
Thank you for that, Scott. Our next question will come from Colton. Colton's question is, if first responders become infected, will they be quarantined in order to keep their families safe? Dr. Klein, could you address that?
I can say that anybody who is infected with COVID-19 would be recommended to self-isolate and stay at home, minimizing contact not only with people outside of the home, but within their home themselves. So if possible, to have their own bedroom with their own bathroom that they can use, making sure to not be sharing glasses, utensils, minimizing contact with other individuals in the household, and making sure to do frequent hand washing and cleaning frequently touched surfaces. So we would definitely, from a public health perspective, require actually that people stay home when they are infected with COVID-19.
Thank you, Dr. Klein. I believe Scott Davis would also like to comment on that.
Thank you. Excellent question. And I can speak that Regional Emergency Services and Chief Butts are in constant contact with all of the emergency providers, both our fire and EMS. We continue to work with the union and all the membership. We want to do the right thing. So if they develop symptoms, they're self-identifying and taking themselves out of service for self-isolation. I commend them for their continued service.
Thank you for that, Scott. Again, if you would like to get your questions into the queue, please hit *3 on your phone. Our next question, or we've actually had several questions asking to get more into details on the utility deferrals that were announced. Will that be water and sewer, garbage and property tax? Jamie, perhaps you could address that?
Thank you for the question. If you had been tuning in last night to our council meeting, administration was directed by council to prepare some recommendations to bring forward on a targeted commercial property tax deferral program. Nothing specific about property tax. However, please know that as an organization, we're always benchmarking and keep an eye on what other municipalities are doing so that we can better understand what we should be doing moving forward.
Thank you for that, Jamie. We've also had several questions come in regarding businesses that have closed and can't pay their rent. So wondering what the municipality would be doing to freeze rent for small businesses or deferrals. And perhaps, Kevin, you could take that, please.
Yes, thank you for that question. So the first thing that we've done is we've struck a task force that will develop some recommendations for the municipality to undertake, and also identify specific programs that we could offer, both through Wood Buffalo Economic Development or in partnership with the RMWB. With regards to rent freezing, that sort of thing, that might be a recommendation or an outcome of the task force, but I can't guarantee that. That will depend upon what the experts have to say. The other, with regards to deferrals, that may also be a recommendation, and we'll see how that shakes. I do want to emphasize that it's widely recognized by just about everybody that's involved in supporting the business community that rents and cash flow issues for small businesses is significant. And what we will attempt to do is to come up with something to help to alleviate it, but by no means are we in a position to make things significantly easier. This is a worldwide issue and affects the entire economy nationwide as well.
Thank you for that, Kevin, and I believe Mayor Scott would like to weigh in.
Yeah, I was just going to weigh in because this is a very common question, and it was something that's top of mind for many individuals. So what I can tell you is that we have no authority as a municipality to freeze rents. I'm often asked that, or if we can take steps that will permit people to avoid rental payments. Part of the motion that I brought last night is that we would encourage the provincial government to look at measures that will assist both commercial renters and residential renters. Now, that's going to be going forward to our council at some point, but either way, it's a lobbying effort that myself and my council colleagues can take on with other levels of government. There has been federal and provincial support announced for businesses, and that's obviously a top priority because we want to make sure business is in a position to bounce back in this region. And the sooner we defeat this virus, the better off we're all going to be to bounce back.
Thank you, Mayor Scott, and I believe Kevin has some additional comments.
Yes, thank you. Also, I do have one suggestion for small businesses that may be listening. Work with your landlord. Most landlords understand the situation that we're in, and work together with your landlord to develop some sort of arrangement to get through this crisis, and also reach out to your bank. There are a number of programs that are available through the banks to assist you with the cash flow issue and to ensure that either mortgage or rental payments can be either deferred, mitigated, or assisted with.
Thank you so much, Kevin. We'd also like to remind residents that if you're looking for the most up-to-date information on service charges or municipal information, you can visit our website, which is rmwb.ca/COVID-19. Our next question comes from Marinder. Marinder asks, was the second case in the region community spread or travel related? Dr. Klein, do you have any information on that?
Thank you for the question. I think that we are seeing more and more community transmission in our cases. I think that is going to shift over time, particularly because there's much less travel happening right now. So the numbers of travelers are overall lower, and our testing strategy, as was announced by Alberta Health a couple of days ago, is also shifting to focus more on our highly vulnerable populations, such as healthcare workers and residents of congregate care and long-term care facilities that we know are at highest risk of potentially being infected and transmitting the virus to others.
Thank you for your response, Dr. Klein. Our next question comes from Amika. Amika asks, what is being done to provide PPE to healthcare workers? Is there a shortage? Maybe Scott, could you take that on, please?
I can't speak specifically for healthcare workers, but what I can assure you is that our regional emergency services, which includes firefighters and EMS, we continue to stay engaged with our procurement and supply chain management department. Because we're a government, we have escalated our working with the provincial government.
Thank you for that, Scott. And Mayor Scott would like to ask something or weigh in, please.
Yes, and that's a very good question. It's something that I raised with Mayor Crawford. He's on the line, but I just want to, he's been extremely helpful and communicative to myself and our administrative team. I want to mention that was a specific issue that I raised with him today, and he assured me that as of this moment, our hospital and the people that work at the hospital do have access to the supplies that they need, including protective equipment. Marie, I'm not sure if you're still on the line with us, but if you'd like to weigh in, please do.
Yeah, thanks, Mayor. Yep, absolutely. I'm still here. Yes, we believe we have adequate stocks, and we have storehouses that we can draw upon if we need resupply. So yes, we're confident we have the necessary personal protective equipment for our staff and for patients visiting if they require it. The only thing we ask is, we are constantly monitoring and make sure people don't misuse these or use them in situations where they're not required. And so that's a big focus for us, is to make sure that we're minimizing the wastage of PPE. Thank you.
Thank you for your responses, gentlemen. Our next question comes from Steve, and he's live on the line. Steve, your line is open. Please go ahead.
Hi there. What if we know someone who's come back from out of country and did not self-isolate?
Thank you for your question, Steve. Scott Davis will take that.
Thank you, Steve. We all bear the responsibility ensuring we're doing the right thing. However, there's others in the community that aren't. Recently, the Alberta Health Services, working with the Alberta government, has created a line to be able to report. If you go to alberta.ca/COVID and follow the links, there's some reporting mechanisms there.
Thank you for that, Scott. Would you have anything to add to that, Dr. Klein?
No, I think I would encourage any Albertan that knows of somebody who is not following the public health advice to reiterate the importance of that for protecting all of us. And that portal that was just alluded to is available as well to report any concerns that Albertans have.
Thank you for that, Dr. Klein. I believe Mayor Scott has something.
Yeah, this is an example of one of those things that if you are observing somebody who's breaking one of the recommendations, and I don't consider them recommendations, I really believe these are mandatory for people to follow, then you tell that person who, through whatever means, virtually, through text message, that they must comply with what Alberta Health is recommending. They are putting everybody at risk by not following the recommendations and exposing us all to greater danger. So it is imperative that people follow these recommendations. This is not a joke. This is deadly serious, and we need to make sure that everybody is following the best advice that we have.
Thank you for that. Again, if you would like to get your question in the queue, please hit *3 on your phone. Our next question comes from Craig. Craig asks, what is the region prepared to do to support the oil and gas industry remote sites? Mayor Scott, do you have anything you could say to this?
You have Kareem from OSCA on the line who might be able to assist, but we have been very concerned with the industry partners. We know that they're struggling already with the price of oil, so I don't know if Kareem is on the line, but if you'd like to weigh in, Kareem, about your partners.
Yep. Thanks, Mayor. I think for those who were on the call yesterday, I was at council. I did commend Mayor and Council for their support in lobbying the province and the federal government in support of our industry. And I know they were just in Ottawa a few weeks ago, and before the pandemic hit and before there was a price war. So, we are working together, and we certainly appreciate Mayor and Council lobbying for us in Ottawa as well as Alberta. Thank you.
Thank you for that, Kareem. Just want to let everybody know that we have about 10 minutes remaining. So if you would like to get your questions in, please hit *3 on your phone. Our next question comes live on the line from Brian. Brian, your line is open. Please go ahead.
Yeah, name's Brian. I have just a quick question for you when it comes to anybody that has any signs or symptoms of COVID-19, whether it's a cold, sinus congestion, cough, even if fever's not involved. How long should they wait before they get tested for COVID-19? Do they wait the 10 days, and if the 10 days, if they're clear, they don't bother getting tested? That's my question.
Thank you for that great question, Brian. Dr. Klein, could you weigh in on that, please?
Sure, I can. And yeah, thank you for the question. I think what I would encourage all Albertans to do is actually to visit the Alberta Health Services /COVID-19 webpage, because there's actually an online screening tool there now where you can put in some information about your symptoms, where you've been, and it'll give you some recommendations at the end for actions and activities that you can do. I mentioned this earlier, but the testing strategy for Alberta has changed in the last couple of days, where we're not recommending testing for COVID-19 for people in the general population, but instead are really focusing on some particularly high-risk individuals, including healthcare workers. So my advice to anybody that has some symptoms would be to fill out the online tool, and then you will receive a call from Alberta Health Services as well, who can provide you some additional advice, but reinforce the importance of self-isolating. So with any symptoms, the most important thing you can do is to stay home for that 10-day period. And just that is the most important thing that you can do.
Thank you for that, Dr. Klein. Again, we only have about 10 minutes left, so if you'd like to get your questions in, please hit *3 on your phone. Our next question comes live on the line from Rob. Rob, your line is open. Go ahead with your question.
Hey, my question was just around the busing and stuff there. The essential workers still rely on taking the buses out to site, and the other people are probably using them also. I was just wondering if any cleaning has been scheduled or anything like that, because I don't really see anyone doing anything about those bus stops.
Thank you for your question, Rob. Kareem, could you address the buses going in and out of site?
Yep. Hi. So again, I was at council. I attended council yesterday, and I touched on that. There are protocols for getting on and off the bus. There are protocols for cleaning the buses, sanitizing the buses, spacing people out on the buses, reducing the number of people on the buses, all in an effort to avoid any sort of physical and ensure physical distancing. So there you have it.
Thank you for that, Kareem. Maybe Jamie, could you just speak to what we're doing when it comes to transit bus stops?
Thank you for the question. In regards to cleaning our transit bus stops, we do clean them quite often. We've increased our cleaning schedule to be several times a day, cleaning those bus shelters as well as our buses, both when they come in and they leave, and throughout the day we do clean them, as well as the shelters. We do the same thing for those as well. So we clean those quite regularly, and we've increased those cleaning schedules as a result of COVID-19.
Thank you for that, gentlemen. Again, if there were any service changes when it comes to municipal, you can visit our website at rmwb.ca/COVID-19 to get additional information. Our next question comes from Michelle. Michelle asks, do we have a testing facility here in Fort McMurray? Perhaps Dr. Klein or Murray could address that?
Yeah, I think I can get that, Kristen. We do. Our testing center is the community health center. It was, and we actually started setting up an expansion to that at the Casman Center. Those were primarily for referrals based on the calling HealthLink 811. And right now, they're still functionally there, but we are obviously not testing. As Dr. Klein mentioned, we are not testing people of the general public right now, and so those are, even though they're open, they'll be limited access, obviously. Thanks.
Thank you for that, Murray. Our next question comes from someone anonymous, and they're asking, if one of my co-worker spouses has COVID-19, am I required to get tested? Dr. Klein, could you address that, please?
Sure. I think an important thing to make sure of is there's a lot of rumors going around of who and who does not have COVID-19, but I want to assure you that any actual cases of COVID-19 are followed up by public health, and part of that activity is to identify anybody that is a close contact of that individual, and to do some education and test them if they need to be tested. If you are a contact of someone that has COVID-19, you don't have to do anything special. You wouldn't be considered at risk. However, some of those general messages still apply because we know that the virus is circulating in our communities. If you had symptoms, it's imperative to stay home and isolate for 10 days.
Thank you for that, Dr. Klein. We are on to our last question now, so we're going to go through our last question. We have a couple of closing remarks here, and then we'll wrap everything up. Our final question comes from George. George asks, have you considered having some industry leaders participate with the RMWB response team in order to share best practices along the way? Scott, could you please take this question?
Thank you, George. Excellent question. Approximately 3 weeks, maybe even a month ago, we started to engage the Regional Emergency Mutual Aid. That's where Chief Butts and our Regional Emergency Services have engaged with the emergency services at each of the camps and continues to have dialogue how to best take care of camp workers plus residents.
Thank you so much for that, Scott. Before we wrap up, Mayor Scott has some closing remarks that he would like to say.
I just want to thank everyone for participating, and I want to thank the vast majority of our community who are putting the community first and who are following the AHS guidelines. It's extremely important, as I've mentioned more than once. I know that people are concerned about the motion that has been brought. And I would encourage people to read it. A lot of people only know one aspect of it or another. Mayor and Council is taking this COVID situation extremely seriously, and we will be dealing with it on an ongoing basis. I can say that our administrative team has been excellent at getting this region prepared. And I know that some are concerned about many different aspects of this, but what I would ask everyone to do is to take care of each other. You know, we have the technology to stay connected. Reach out to your neighbors, and especially anyone who is alone or in distress. I'm very concerned about the young people in our region. This is something that, you know, is affecting everybody, including them. We as a community have been through a lot of challenges, and we're going to come through this one together. So please take care of each other, and we will be doing more of these town halls, and I hope that people have found this useful.
Thank you so much, Mayor Scott. So our time has come to a close today, and we realize that you may not have had an opportunity to have your question asked and answered. So again, we have our municipal website, which is rmwb.ca/COVID-19, which has our local COVID-19 information. And as well, you can visit the alberta.ca/COVID website as well, where you can get more provincial up-to-date information. So we would like to thank all of our residents for joining us today, as well as the panelists. And we hope to do more of these in the future. The audio will be available for this soon, so you will see that on our rmwb.ca/COVID-19 website. Thank you so much for your time, everyone, and have a great evening.